Osteogenesis imperfecta, which is also called brittle bone disease, is a rare genetic disorder. It occurs 1 to 20,000 people, and in some population, it's even 1 to 60,000 people. It is an autosomal dominant inheritance in most cases, but some cases, some types, as we will see, could be autosomal recessive or spontaneous mutation. Here we can see some symptoms that occur in most of the cases of osteogenesis imperfecta in all the types of the disease. Multiple fractures, which is the biggest problem of the sick people, as the bones are very fragile and they can be broken without any trauma at all. Dentiogenesis imperfecta, which means that the teeth are a brown color and very weak teeth, and blue sclera, which means that the white part in the eye become really blue. In some cases, we also see hearing problems of varying degrees due to problems in the middle ear. And now let's talk about the genetic changes at the gene and the protein level. There are two genes that are responsible for creating the final and the functional structure of type 1 collagen, which is responsible for the strength of many tissues in the body, including bones, COL1A1 and COL1A2. When one or both of them are damaged due to a mutation in the DNA, the collagen protein that is formed fails to form the triple helix structure as it has to be in the normal situation, and therefore it's not functional enough, and it creates weak bones with a less dense structure. We see in the picture a bone of a patient with osteogenesis imperfecta. As we see, the bone is much less dense than normal bone and has like holes in it. In the middle picture, we see a bone of a 2-year-old patient with osteogenesis imperfecta when it is deformed due to a lack of collagen type 1 that responsible to the strength of the bone. In the left picture, we see the external appearance of the leg when it is deformed. The diagnosis of osteogenesis imperfecta can be done in few ways. Genetic tests might identify the exact mutation in the COL1A1 or COL1A2 genes. The doctor can use also physical examination to check blue sclera, dental abnormalities, and of course signs of skeletal deformities, which are very common. Actually, X-ray is the most useful way to reveal bone deformities, fractures, and other skeletal abnormalities. The doctor also can use bone densitometry, which is called DEXA scan. This test measures bone mineral density and can assess the severity of osteoporosis in osteogenesis imperfecta patients. It's not only to know if a patient will have osteogenesis imperfecta, but to know the stage or the exact type. Ultrasound can be used in prenatal diagnosis, and also skin biopsy can be a way to identify osteogenesis imperfecta, but it's not very common. There are 4 main types of osteogenesis imperfecta, and we will say a few words about each of those. Type 1 is the mildest type, and it's the most common form. It is characterized by multiple childhood fractures, blue sclera, normal stature, and a relatively normal life expectancy. People with osteogenesis imperfecta type 1 can live almost normal life if they get good treatment from childhood to adulthood. Type 2 is the most severe type, and it's often diagnosed prenatally in an ultrasound at the second or the first trimester or at birth. It's very severe, multiple fractures. Each touch at the body can cause a lot of fractures, and there are also a lot of deformities in all over the body. A high mortality due to chest deformities, and the lungs are not developed enough, so they can't breathe by themselves. Most of the cases are associated with spontaneous mutations in COL1A1 or COL1A2 genes, and it's often lethal in the prenatal period or right after birth. Type 3 is severe but survival beyond childhood, very frequent fractures, deformities, and short stature. And as we see in the picture, it's a girl, she's 3 years old, and it's progressive skeletal abnormalities without any surgery or treatment, as we'll say later. And it can be autosomal dominant or spontaneous mutations. It can be both, but most of the cases, as I said before, are autosomal dominant. Type 4 is characterized by the wide range of severity. It's from moderate to severe, and it has a few degrees of deformities, short stature, and dental abnormalities. All the cases are autosomal dominant, and it's the second common type of osteogenesis imperfecta. And individual may experience fractures and skeletal abnormalities, but the severity is different between individuals. Bisphosphonates are a group of drugs that containing two phosphonate groups, PO3, that inhibit bone breaking down by targeting osteoclasts, that these are the cells that are responsible for breaking down bone tissues, and in addition they also encourage mineralization of the bone so new bone tissue is formed. The drugs are very effective, and it can prevent up to 50% of the fractures and the deformities in the spine and the bones. Most of the kids with osteogenesis imperfecta will have surgeries to correct deformities and to reinforce the weakened bones. The most common surgery is a placement of metal rods in the long bones of the legs, but there are also other surgeries to correct different kinds of bones. There are a lot of researches lately and experimental treatments that are used in the last 5 years in order to correct the actual mutations and not only to treat the symptoms. The first one is gene therapy to correct the mutation that caused the OI, depending on the kind of the mutation in the COL1A1 or COL1A2 genes, or both of them. And the doctor use viral vectors or gene editing like a CRISPR-Cas9 method in order to replace the mutated gene in a normal gene, and it works in most of the cases. And there is also stem cell therapy, which they inject into the bone stem cells that can become bone cells, and it can be the patient's stem cells or from a donor, but most of the cases are from the patient cell itself. And it enhances bone density, it reduces the number of the fractures, and it improves overall bone health. There is also a try to use stem cell therapy for severe cases of osteogenesis imperfecta during different stages of pregnancy. There are a lot of successful studies in animals, but they are still in research, so they didn't use it to actual patients, but it will come in the next few years. And now I want to show you a real case, a child named Israel, and he's from Israel, obviously. I know his both parents, they are really special people. This is their second son, and they have a few kids after him. And when he was born, the doctors diagnosed 100 fractures, more than 100 fractures in his skull and all over the body. And this was diagnosed as osteogenesis imperfecta type 2. And as we said earlier, most of the kids die in the uterus or right after birth. And he survived, as you see. And he is a really special child. He sings, he plays, he's very happy. And his mom had an interview with a big journal in Israel, and she said that this special child not only didn't stop their lives, but he brought a lot of blessing and hope and happiness to their family, and he changed all the family in a good way. And I wish he will remain this happy and hopeful even when he's in hospital for weeks or months. And we don't have time for questions, so have a great weekend and vacation. Bye!